Hello and a good day to all the listeners of Acharya 90 FM, your own radio. I am Mrs. Akila Maheshwari, Vice Principal of Acharya Marathe College, and today we are here to make you meet a very interesting guest on our podcast, Dr. Vidula Bhosle. Welcome, madam.
Hello.
Yeah, she is an obstetrician, gynecologist practicing in Chembur. She has done her MS and DNB and is specialized in urogynecology. She has been trained in colposcopy. Sorry, I'm very bad at these pronunciations. She's been trained in colposcopy, which is used for in the case of cervical cancer diagnosis and treatment. A warm welcome to you, Dr. Vidula.
Hello, everyone.
Yeah. So, taking off from the beginning, we are looking, first of all, listeners, you must know that this is the Cancer Month throughout the world, and it also encompasses the Cancer Day in February, and all types of cancers are covered. But of late, we have seen a lot of interest in cervical cancer, because when I was hearing the financial budget the other day, our Finance Minister Nirmala Sitharaman specifically mentioned funding in the budget for vaccination for cervical cancers. So to start with, doctor, can you tell us what are the types of gynecological cancers that women can face in a lifetime?
Yes. So the woman's reproductive system has two parts, the external and the internal. Externally, we have the vulva. Internally, there is a vagina, the uterus and the ovaries. The uterus comprises of the fallopian tubes, the body of the uterus and cervix, which is the mouth of the uterus.
Right.
So of this, the commonest and the most important one is the cervical cancer, which we will be talking about today.
Right. So the most common is cervical cancer. Can you have any data on the percentage of incidence or something like that?
So right now at present, in India, cervical cancer is the most common cancer affecting women. More than 200 women die every day in India from cervical cancer.
My God, that's scary.
So that is quite a lot. So that is the reason we are here to discuss and create awareness about the same.
Yes. I just want to understand, because cancer is never been as a disease known to be something which you can prevent. In the sense, people talk about the types of food you eat, or the stress levels, or genetic predisposition. But when I was listening to this speech in the budget, they were talking about some vaccine.
Yes.
So I would like to know, is cervical cancer preventable?
Yes, in fact, it is the only cancer which is found to be preventable, as it is caused by an virus, which is the human papilloma virus. Okay, so HPV virus, infection by a virus, causes this cancer, and hence we have found a vaccine which helps in preventing cervical cancer.
Now, I've really got confused as a lay person, doctor. If it is a virus,
right,
then how is it a cancer? I mean, if I understand if I have a viral disease, then I just take antivirus. If I get an HPV infection, I take an treatment and I get cured from it. But
Right.
here we are talking about both HPV infection, and I thought cancer was about cell spreading. So it's a little confusing for me.
Yeah, so I will explain you that. What happens is HPV is something which is sexually transmitted.
Right.
By the age of 50, more than 80% of the women have already acquired HPV infection. But the thing with HPV is that in most women, it clears off by itself in an year. And even if you have this infection, you would not know, because there are no specific symptoms or any disease that is caused by it. So in women who have persistent HPV infection, like in women in whom the infection doesn't get cleared off by itself, this persistent HPV infection can bring about cellular changes by integrating with the nucleus of the cell. Okay, and that is how it starts causing precancerous lesions initially, which are all invisible to the naked eye. And then from precancerous stage, it develops slowly into a full-blown cancer, which takes, so the time of onset from acquiring HPV infection to be diagnosed with a cancer is from few months to many years. It could be anything, ranging from months to years. This infection could remain persistent in the body and eventually lead to
cancer. Okay. So then, is it, I mean, if you have just as a lay person, so if I'm a woman and, I'm not taken the vaccine, if I have a uterus surgery, will I be free of the cervical cancer?
Yes, definitely. If you don't have a cervix, you wouldn't have the cancer of the cervix at all.
Oh, wonderful. But we are not talking about removing the uterus in this case. We are talking about a vaccine.
How can we prevent it? Right.
So can you tell us what is this vaccine? What are the types, and how can it be taken?
Sure. Yes. So right now we have had this vaccine in the market for more than 2 decades.
Wow.
Yes, it has been.
And they're only hearing of it now.
Yes. Yeah. So basically there is a vaccine. There are 3 types of vaccine that we have: a bivalent vaccine, a quadrivalent vaccine, and a nanovalent vaccine. Now what is this? Basically, now that we know that the causative agent of this cancer is a virus, HPV virus.
Yes.
So what we have done is we have simulated this virus and got a vaccine out of it, so that whenever this vaccine is given to any individual, any woman, what happens is it is going to create antibodies against this simulated virus. Okay. So whenever you have an HPV infection, you already have antibodies to fight off this virus in your body. So that is how a vaccine works, right?
Yes.
As we have seen previously also. So now what happens, there are types of HPV virus, different strains which are responsible for cancer. Of this, the most important is HPV 16 and 18. These are the high risk types of HPV which are responsible for more than 80% of the cervical cancer. So when these 2 strains are combined in one vaccine, we call this bivalent.
Okay.
Now there are low risk types, HPV 6 and 11, which mostly cause anogenital warts. Okay. But they can also eventually turn into a cancer, and therefore we have another type of vaccine which has these 4 strains: 16, 18, 6 and 11.
Okay.
Now we have a nanovalent vaccine as well, which is covering even more strains, 9 strains of HPV virus, which are known to cause cancer.
Right.
Okay. So we now have a full coverage for this. Now the bivalent vaccine, the quadrivalent or the nanovalent vaccine, any of these vaccines, they have to be given to girls and boys both before their sexual debut, before the initiation of sexual activity. So the ideal age is 9 to 15 years.
Okay, so before losing your virginity, you have to get it.
Yes.
Whether you're a man or a woman.
Yes, for girls and boys both, because see, this HPV virus is going to cause anogenital warts.
Right.
Okay. Or it could also cause penile cancer in very rare cases.
Yes.
So, and since HPV is a sexually transmitted virus, if you are giving this vaccine to young boys, eventually they are protected against the infection. And in turn, they would not transmit this infection to the females probably around them who are unvaccinated.
Right.
So,
but I know my questions may seem rather funny to you, but if you are using a condom, can that not prevent the HPV virus?
Condom always is going to prevent all sexually transmitted infections.
Right.
Not just HPV. Right. All sexually transmitted infections will be prevented by condoms.
Yeah.
So that is irrespective, obviously.
Yeah. But still, obviously, if you're going to procreate, you're not going to have sex with a condom, right?
Yeah, right.
So obviously, this is better to have a vaccine.
We need to think over.
People don't like to have sex with condoms for whatever reasons. So I think, but what about costs? I mean, we talk about vaccines. We know, for example, you have this vaccine, that vaccine, but I don't think people are taking vaccines against pneumonia, or, the vaccines are so expensive.
Right.
Super expensive. I heard you have a vaccine for this, it is so much. And then we say, but hone ka chance to itna kam hai, why take it? And then you get it. So what about the costs and side effects?
So basically, right now the vaccine in India is not provided free of cost. The government has yet not been able to provide it to all the girls and boys of the ideal age that we are talking about.
Right.
But obviously, there are measures which are being taken to make it more cost effective. Okay. So we have the bivalent and the quadrivalent vaccines which are taken in 3 doses after the age of 15, and in the age of 9 to 15 they are taken in 2 doses. Okay. Over a period of 6 months. So now these 2 doses, I am sure it is not cost effective for most of the population, but those who are affording can definitely take it to ensure a better protection.
Yes. So, but then there should be awareness. I mean, I know that recently there was this huge social media
Stunt.
drama
Yes.
with Poonam Pandey.
Yes.
You know, it was like so shocking. I remember I also was, oh my God, poor thing, she died at 32 of cervical cancer. And
Right.
this was like, oh my God, everybody was so worried. How did she die?
Right.
And all of a sudden, a week later, you find that she actually hadn't died.
Yeah. She wanted to create an awareness about cervical cancer.
But that has also created a controversy that, you know, a lot of people feel that she's made it like a joke out of a serious thing, because having cancer is something very
Yes,
serious
definitely.
and difficult. So I don't
it
think
is bound
a lot
to hurt
of
people's sentiments.
Yeah.
And I agree.
But one must, appreciate the fact that she actually did create awareness about cervical cancer.
Because people don't know much about it.
Yes,
right?
yes.
Just now that I have said that there have been so many extensive studies on this vaccine.
Right.
The safety is ensured, because I have
Yes,
patients
doctor.
coming to me who ask me whether it is safe. Yes, it is safe. It has been in the market for such
For
a
2
long
decades,
time.
yeah.
But just that, we have never been aware of it.
Yeah,
as
and I
much.
think we had a lot of focus on breast cancer. For some reason, we always felt breast cancer was,
that is important.
It is equally important, of course.
Yes.
Yeah. What about side effects of the vaccine? Are there any significant side effects?
No significant side effects except for mild pain, mild to moderate pain at the site of injection.
Okay.
And of course, you have to know about your allergies. If you have any known allergies to
Okay.
components of the vaccine, obviously
Right.
you have to inform about them.
In
And then
advance.
your gynecologist will guide you accordingly, whether or not you are a suitable candidate to take the vaccine.
Okay, now if I'm looking, now we are looking at the future generation 9 to 15. We know that earlier in India, virginity was a big virtue, but now I think we are more liberal, and people are getting married later. So it's perfectly all right for young adolescents and young youth to indulge in a sexual activity. And so it's all the more important to have the vaccine. But for women who have already passed the bus,
Yes.
who are 35, 40 or above that, and as they age, the predisposition for cancer could be more, or they may be high risk.
Yes,
What can be done? How can we prevent it? What is the solution now?
Yes, so now since most of the women who get to know now past their ideal age, so what can they do?
What would be that age?
Yeah.
35, 40, 50?
So we can vaccinate women up to the age of 45 years.
Oh, okay.
So catch-up vaccination can be done up to 25.
Up to
but
25.
even in the age group of 25 to 45, that is what
Okay.
FOXI recommends. FOXI is the Society of
The Society
Obstetricians
of
and Gynecologists that we
Okay.
have
Yes.
all over India. And FOXI has recommended that you can vaccinate women up to the age of 45. The only thing being, the efficacy of the vaccine goes on declining.
Yes.
So the efficacy is about more than 90% in the age group of 9 to 15 years.
yes.
But this is going to gradually decline as
it?
you will already be infected by HPV virus in most cases.
And
women
you
are going to
probably
come
might be
after
having
25.
some
Yeah, some
antibodies.
immunity by yourself, but still the vaccine won't be as effective because
Yes.
the process might have already started.
yeah.
The infection might have already started.
Yes.
So the efficacy goes on declining. Nevertheless, I feel women should take it. It is better to be late than never.
So then what about screening? If I can't take a vaccination, I'm above
Okay.
45.
Okay.
Now, I had a cousin who...
No, even after vaccination, you have to continue screening.
Oh, okay. So can you tell us a
Yes,
bit
yes.
more about screening, the
Definitely,
procedure and
definitely.
everything,
So-
frequency, etc.?
Yes, so we spoke about vaccination right now. We spoke about the schedule and cost and everything. Now, even after you're vaccinated, what are you supposed to do?
Yeah.
So, before the age of 30, you can just have a pap smear or an LBC. We call it
Okay.
a cytological test.
Okay.
But after the age of 30, what is recommended is you can have an HPV testing.
Okay.
So if you are HPV positive, if you are infected with an HPV virus, then a cytological examination will be conducted on your sample to see if there are any changes in the cells of the cervix.
Okay.
Now here I would like to clarify how the test is done,
Okay.
because most of them won't know whether it is a blood test or what is it exactly. So HPV test is a very simple OPD procedure in which you have a smooth sterilized instrument which is used, and it is moved across your cervix.
Okay.
So that it loosens the cells, and you take those cells and you mount them in a liquid medium and examine it under a microscope to see if there is any infection. So that is how an HPV test is done. Okay. It's not a blood test, it is not something else, it is this.
It is this way.
Okay. So now when you are HPV positive, a cellular test, cytological changes are seen on a pap smear or an LBC.
Right.
And if there are cytological changes as well, you are supposed to undergo what we call as a colposcopy. So colposcopy is something where you are going to visualize the cervix with the use of a specialized scope or a device which are called the colposcope. What will that do? That is going to actually detect the disease in its invisible stages. When it is not visible to the naked eye.
That's colposcope can detect.
Yes, colposcope helps in detecting and treating as well.
Oh, treating as well?
Yes. So if you have disease in very early stage, you can detect it even without losing your uterus.
Wow.
Yeah. So that is the
so you put medicine in it and use it?
No, there are different techniques which can be used. There is leap therapy, which we call as the electrothermal therapy for it. But all of these are the details later on. But what you can do for screening is basically have this HPV test done every 5 years or a pap smear or a cytological test done every 3 years.
Okay.
Whichever is possible.
Right. That's wonderful.